So students, today we will be revising on the topic of deep vein thrombosis, also known as DVT. So we will discuss this. So this is a picture of deep vein thrombosis. So the deep vein thrombosis usually occurs in the deeper veins. Understand? You have superficial and deep veins, no? So it usually occurs in the deep veins. This is in your leg portion. This is your leg portion, so it usually occurs here. So this is the picture of the normal blood flow. This one, it usually flows upside, that is towards your heart. Okay, and in this deep vein thrombosis, what happens because of the weak or else the damaged veins? What happens? The blood, no, it usually clots here. It usually clots here. That's why. Okay. It usually clots here, and what happens because of the blood clot? The abnormality occurs. It arises here in this area. Is it clear?
Yes.
So this is how it begins. You can say. Okay. So here are some of the silent symptoms of deep vein thrombosis. Here are some of the silent symptoms. So because of the abnormalities in the, in the leg, now what will happen? Heaviness and swelling. Since there is abnormalities, so what will happen? Obviously, the person will feel heavy. It's not it, and as well as the person will feel heavy also, like in the leg, that is in the extremities, and the person will also feel pain. All right, the person will also feel pain, and also it will be tender. Tender means it will become sensitive. That area, the area where uh, the leg is affected, no? It will happen. It will happen in that area. Okay. So next is skin discoloration and ulcers. So skin discoloration and ulcers, what will happen? Because of the blood clot, there will be changes. Okay, because of the blood clot, obviously there will be changes. It's only because there is inflammation going on. Inflammation going on inside the leg. So obviously there will be changes in the skin, and ultimately it will lead to ulcer. And the next is a warm sensation, means uh, the person will feel warm in whatever area it's been affected, no? That it will become warm. Understand? It won't be the normal temperature of what the person was feeling. Is it all right? Is it clear through this portion? What happened? What happened, Sheetal? Why are you laughing? Something funny? Yes,
No, ma'am.
something funny. Why are you laughing then? Okay, let's move to the next. Okay, in which area it will occur? In your muscles area. Alright, that is calf muscle. So this is known as the calf muscle, C-A-L-F, calf. So this is the calf muscle. So in the calf muscle, the pain usually occurs. And in this, what will happen? There will be cramping. Cramping means what? There will be muscle contraction. Alright, there will be muscle contraction and as well as soreness. Soreness means the person will feel pain in the leg. It will pain in that area. Understand? In the DVT area, means deep vein thrombosis area, in the affected area, the muscle will pain. That is the calf muscle. Is it clear till this area? Is it clear? Hello?
Yes. Yes, ma'am.
Okay. Is my voice okay now, Srijana? Can you hear me?
No.
Yes, ma'am.
Yes, ma'am.
Okay, okay. Okay, and another sign and symptoms that you will find is swelling of the leg or calf. The same thing, like this is the normal leg. another leg, and this is the like the affected area. It will swell. Why? Because the affected area will be inflamed, right? It will become since it's not normal, it will become inflamed and ultimately it will swell up. And here what will happen? Pain. Obviously, the leg will pain. Understand? So, because of the pain in the leg, what will happen? The person will find difficulty in standing as well as walking. Because why? Because the person is giving pressure in that affected area, right? So that's why the person will feel pain. And the next is warm and redness. We have already discussed about this, but still I'm just repeating again. So the person will feel warm in that affected area. So obviously, like if there is any inflammation, if there is any like like scar and all those, what will happen? Obviously, that affected area used to be warm, no? And it used to become red in color also. So same thing in this DVT, that is deep vein thrombosis. Also, you'll find the same thing. All right. So this is what usually occur. So next is pulmonary embolism. So this deep vein thrombosis, it will lead to pulmonary embolism also. So what will happen in this pulmonary embolism? So the blood clot, it will break. When it will break, it will be known as embolus. All right, it will be known as embolus. So this embolus, it will go upside. So this is the vein. All right, so this is the vein. So this embolus, with the help of the vein, it will go in this direction, that is in the upward direction. And when it will reach this lungs, what will happen? Obviously, since the lung and the heart, like they are attached with each other, no, they are attached with each other. What will happen? Obviously, there will be some abnormalities going on inside, no? So the person will find difficulty in breathing. It's not that the person will find difficulty in breathing, as well as it will hamper the heart also. All right, it will hamper the heart. In both ways, it will hamper. There will be shortness of breath. There will be chest pain, and it will lead to coughing up blood also. When the person will cough, what will happen? Since the person is giving so much pressure, right? So since the person is giving pressure in that from the inward side, right? So obviously, like the blood clot, it will come out. Understand? I think it's clear enough till here.
Yes.
Okay. And you will also find some symptoms in the pulmonary embolism. So all this like sudden like chest pain, like difficulty in breathing, then the heart also will affect. I have already said there will be heartbeat. All right, means there will be rapid breathing, means the person will breathe very fast, and the person will sweat also. All right, because there is some abnormalities going on inside the person, right? So that's why obviously the person will find difficult, and ultimately the person will sweat because it's very much tiring, not it? And anxiety, coughing up blood, and all this, that fainting, like loss of consciousness, since the person is already too much tired, no? So it might lead to like fainting also. Okay, so all these heart palpitations, the heart will beat very fast, signs of shock, the person will need to shock. If the person will have shock, what will happen? Obviously, the blood circulation, it won't be normal anymore. Alright, so that's why it will hamper in this manner. I hope it's clear. Okay, so
Yes.
all this unexplained sudden breathlessness, the person will find difficulty in breathing, then sudden chest pain, the person will feel pain in the chest area, then coughing up blood. So all these are the signs and symptoms of PE, that is pulmonary embolism. Is it clear? And this deep vein thrombosis, it will lead to post thrombotic syndrome. So these are some of the picture. So these are some of the picture. So what will happen because of the damage of the veins, no? Because of the damage of the veins, what will happen? There will be uh, blood clot, all right, and because of the blood is not flowing normally anymore, so it will affect in that area, and because of that, it will cause pain, it will cause swelling, it will cause discoloration, and sometimes it will lead to skin sores also. Okay, so this is known as this post-thrombotic clavictic syndrome. It is also known as that. Okay, now let us discuss about the causes and risk factors. Means what can be the cause of this deep vein thrombosis and who are at the risk of having this deep vein thrombosis. The first is cancer. Whoever like a person is having cancer patient, they are mostly likely to have this deep vein thrombosis. Next is smoking. If a person like smoke, if a person does all this kind of alcohol, no? Alcohol, tobacco, all these things, then the person will be at the risk of having deep vein thrombosis. Next is long-term use of hormonal drugs. Means if uh, means if a person is having too much of contraceptive medicines, like for controlling birth control, all those medicines, no? If they are having too much, what will happen? They will be at the risk of having deep vein thrombosis. Next is prolonged bed rest, prolonged sitting, prolonged standing. If a person lie down, or if a person sit down, or if a person stand for too long, what will happen? They will be at the risk of having this deep vein thrombosis. So that's why the person should change his or her position frequently. All right, time to time. Next is pregnancy. So a pregnant lady also, they are at the risk of having this deep vein thrombosis. Next is injuries and fractures of the leg. Like if there is any injuries, if there is any cut, or if there is any if the bones and all will break, no, what will happen? Obviously, like it's not normal anymore, right? So because of all this, what will happen? There will be inflammation, clotting of the blood. All right, so that's why it will lead to DVT, that is deep vein thrombosis. We have already discussed this. Next is varicose vein. So next is varicose vein. So if a person is having varicose vein, in the last class we have already discussed about this varicose vein. So if a person is having varicose vein, then they are also at the risk of having this DVT, that is deep vein thrombosis. Next is obesity. Obesity, it will lead to, means if a person is too much overweight, what will happen? They will be at the risk of having this DVT. All right, means giving too much pressure, no? Giving too much pressure, and ultimately it will lead to DVT. Okay. Next is over 60 years old, means elderly people. Elderly people, they are at the risk of having this DVT. Why? Because the veins usually becomes weak. Listen, it usually becomes weak, as well as sometimes it is a bit damaged also. So that's why they are at the risk of having DVT. Next is genetic, means it occurs genetically also. Like if your forefathers and all were having them, they will be at the risk of having, those person will be at the risk of having DVT. Next is injury or surgery. So if a person have any injury or any inflammation, and then the person will be at the risk of having DVT. Next is stroke. Means stroke usually occurs. Why? Because of the poor blood circulation. All right, because of poor blood circulation, it usually arises stroke. So if a person is having stroke, like they are at the risk of having DVT. Next is heart failure. So heart failure usually occurs because of that reason, pulmonary embolism. You remember, no? So it is linked with that heart failure. All right, is it clear?
Yes.
Okay. So how can we prevent ourselves from this deep vein thrombosis? First is, since the risk factors was also obesity, all right. So the person have to watch upon his or her weight. That is, the person should lose his or her weight. Understand? And next is exercise. The person should perform some exercise also. All right, the person should perform exercise. Next is they should wear comfortable shoes, whatever shoes they are comfortable with, but not heel. Okay? So they should wear that kind of shoes. Next is physical exercise. They should perform some physical exercise and they should also avoid harmful habits. Harmful habits like what? Tobacco, all those, no? Smoking, having alcohol, all these things like they should avoid. Okay, so here are some uh, exercises like the pictures of some like exercises. First is foot palm, like the person should uh, palm the foot in this manner. Like suppose this is the feet, no? So like we should palm like this. Next is knee lift. So the person should lift his or her knee in this manner. Like, you can see from the picture itself. Okay, next is chair leg raise. So they should raise the leg in this manner. And next is ankle circle. So suppose this is the ankle, so they should circle in this manner. Alright. So these are some of the exercise that a GBT patient should perform. Okay. So here are some few exercises. Foot exercise. So it's like this. Suppose this is the foot. So how they should do like this. Okay, next is lift toes upward. So they should lift their toes in this direction. Suppose this is the toe, so like this. In the upward direction, they should move. Next is clenched toes. They should like this. They should do. Suppose these are your feet. No? They should do like this in this manner. They should bring up all together in this manner. Next is spread toes. It will spread like this now. First was like this, then now like this. Okay, they should spread their toes like that. Next is a rotate ankle, so they should rotate their ankle in this manner. And the last one is like they should fold their legs in this manner. First in this manner, in the right side or in the left side side. And next is another side, in the opposite side. They should do like this. Why they should perform all this exercise? So that the blood circulation will be rich. Yeah? The blood circulation will be regular. So that's why they should perform like this kind of exercise. The DVT people, the DVT patient. Okay, is it clear? So it comes to an end.
Yes, ma'am.
DVT. Okay, if it is clear, then let me ask. Today, let me start from the last one. Okay, Yatulika. Yatulika, can you
Yes,
tell me?
ma'am.
Okay,
Yes, ma'am.
deep vein thrombosis usually occurs in which vein? In which part of the vein?
Calf.
I'm asking vein, not muscle. In which part of the
Yes, yes,
vein?
yes, ma'am.
In which part of the vein? I'm asking vein, not
Deep vein.
deep veins. Okay, good. Okay, next, Tumpejilan. Tumpejilan, can you hear me? Tumpejilan. Okay, Trishna Rajbongsi. Trishna Rajbongsi.
Yes, ma'am.
Okay, can you tell me any sign and symptoms of DVT? अगर एक
Ma'am,
इंसान
this
का DVT होने से उसका क्या क्या बदलाव आएगा उसका शरीर में?
chest pain.
Chest pain, okay, occurs, but it is connected with the pulmonary embolism? Can you tell me in general?
Swelling,
हाँ,
leg,
swelling of the feet. उसके
pain,
बाद okay, pain होगा. Anything else?
skin discoloration.
Okay, skin discoloration. Okay,
Skin discoloration.
okay, okay, very good. Okay, next, Surajit Kalita. Surajit Kalita, can you hear me?
Yeah.
Okay, in which, okay, the vein
Ma'am.
thrombosis usually occurs in which part of the muscle? In which part of the muscle? Hello,
Calf muscle.
calf muscle. Okay, good.
Calf muscle.
Okay, okay, good. Okay, next, Srijana, can you hear me?
Yes, ma'am.
Okay, deep vein thrombosis, it leads to what? Yes, it can also lead
Ma'am.
this deep vein thrombosis, no? Like, what is the
Yes,
another
ma'am.
cause?
Ma'am, pulmonary embolism.
Okay, what happens in pulmonary embolism? What gets affected?
Ma'am, lungs
Okay, lungs as well as
and heart.
heart. Okay, okay, good. Next, Sheetal. Okay, can you tell me some of the symptoms of pulmonary embolism?
Mom, uh,
Mm-hmm.
coughing out blood,
Okay, anything else?
rapid breathing.
Rapid breathing. Okay, 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 good. Next, Sinkamchi.
Yes, ma'am.
Okay, can you tell me anything else? Like, he
Pardon?
said, Sheetal, he said about the symptoms of pulmonary embolism, that is coughing up blood and rapid heartbeat. Or what? Yeah. Can you tell me some more?
Swelling
No, no, no.
symptoms, ma'am.
I'm asking about pulmonary embolism, not general one that DVT, no? Not that one.
Sudden shortness of breath.
Okay. Anything
Mm,
else? In which part of the body it will pain? I mean, if there is pulmonary embolism, in which part? It will pain in the
par-
head.
pardon, ma'am.
If a person is having pulmonary embolism, na, so in which part of
Yes,
his
ma'am.
or her body will pain? I mean, in the head, in the chest, in the leg, I mean, in which part?
Yes,
Ah,
ma'am.
chest pain. Okay. Okay, good. Next, Samuel. Samuel. Samuel, can you hear me? Hello. Okay. Next, Salam Girijad. Okay, Samuel. Okay. Okay, Samuel. Can you hear me now, Samuel? I think your network is not good. It's okay, Samuel, no problem. Okay, next, Salam Girija Devi.
Yes, ma'am.
Okay, can you tell me some of the risk factors of DVT?
Yes, ma'am.
Age. Okay, elderly
Yes,
people, no?
ma'am.
You say
Yes,
elderly
ma'am.
people. Okay, not it doesn't have occur in all the ages. All right, you have to mention that specific age. That specific age will be like elderly people, mostly who are 60 plus. All right.
Older than 60, ma'am.
Okay. Anything else?
Injury or surgery.
Okay. Anything else?
And pregnancy, ma'am.
Okay, pregnancy. Okay, next, Rudolph, continue with the risk factors. Continue. Salam Girija Devi said age, that is elderly people. Then, and what you said? What you said? I forgot. Yes, Salam, what you said? I forgot. I remembered only elderly people. Oh, injury. And another thing, what you said?
Surgery. Pregnancy,
Oh,
ma'am.
pregnancy. Okay. Okay, she said all those three. Please continue, Rudolph. There are some more. Rudolph, can you hear me? Rudolph? Hello. Okay, Rifan Pale, can you hear me? Rich person? What about rich person? Can you hear me? Rich person? What happened? Rashmi Sonowal?
Yes,
Rashmi?
ma'am.
Okay, please
Yes, ma'am.
continue. Please continue with the risk factors.
Ma'am, smoking,
Okay,
heart failure,
okay,
cancer,
okay.
stroke,
Stroke.
obesity,
Okay, okay, okay. Very good. Next, Prakriti. Prakriti Rai. Okay, Phinisha. Phinisha
Yes,
Singh.
ma'am.
Okay, can you tell
Yes,
me
ma'am.
uh, how can a person prevent himself or herself from this DVT? I mean, what they should do, what steps
Uh,
they should take.
uh, weight loss, weight
Okay,
loss, exercise, wearing comfortable shoes,
okay,
and physical exercise.
physical exercise, na? Okay, okay. Is it clear, everyone?
Yes,
Are you
ma'am.
okay? I hope everyone is clear about this DVT. Okay. Your exam is approaching. Remember, 25. 25 is 25 is Tuesday, no? Next week Tuesday. Okay. It will be same thing. Means same pattern. It will be MCQ. Okay, however you had in your first session exam, same process it will be. All right.
Yes.
Okay then. Thank you everyone.